Proton beam costs $100,000, takes 2 months, and for prostate cancer, the data shows it gets inferior results as a 45-minute procedure most men have never heard of. I'm Dr. Ajay Bhatnagar. I've been a radiation oncologist for over 20 years, and I've watched countless men choose the expensive option when they could have gotten a better, faster result at a lower cost. And it's not their fault. Let me explain. Most men who look into proton beam come away thinking the same thing. This is the most precise, most modern radiation out there. More precise means fewer side effects and a better shot at a cure. That idea stuck because the technology is real. Protons stop inside the body at a set depth. Standard radiation passes all the way through. In some cancers, that difference matters a lot, but not for prostate. For prostate cancer, the prostate sits deep in the pelvis, surrounded by soft tissues. The beam doesn't need to thread around a sensitive organ the way it does for a brain tumor. The precision edge that makes proton beam worth it in some cancers doesn't apply here the same way. The technology is advanced, but the outcome advantage for prostate cancer, according to the data, doesn't exist. There's a reason proton beam became the default best answer anyway, and it matters. Studies comparing proton beam to standard radiation for prostate cancer keep landing on the same result. No meaningful difference in outcomes. A man who gets proton beam and a man who gets standard radiation have about the same cure rates. At 1 year out and 5 years out, the side effect reports are similar too. The proton beam patients spent more money and traveled farther. The results are the same. The cost is where it gets hard to accept. Proton beam runs 2 to 3 times what standard radiation costs. Insurance often won't cover the difference. Some men pay out of pocket. They pay because they think they're getting a better outcome. The numbers don't show that. Meanwhile, LDR brachytherapy, radioactive seeds placed directly inside the prostate, show cure rates above 97% for low and intermediate risk prostate cancer. The procedure takes 45 minutes, no daily trips to a clinic. Most men go home the same day. In my practice, nearly all the men keep their sexual function. That combination doesn't show up in proton beam data for prostate cancer. The most advanced label does real work. Men hear advanced and they hear better. For prostate cancer, the 45-minute seed procedure gets better results than the machine that costs more than a NASA rocket. Men are paying more for proton beam for prostate cancer. The research shows it does not work better than the cheaper options. The question now is whether this is true in your situation too. Ask yourself these questions right now. Did your doctor say proton beam is more precise or more advanced without explaining whether that applies to prostate cancer? Were you shown a side-by-side comparison of cure rates and side effects between proton beam and brachytherapy? Did anyone walk you through what the data shows for proton beam versus brachytherapy, specifically for your risk level? Did your treatment team mention a brachytherapy specialist as a part of your options? If you answered yes to the first question and no to the rest, you haven't had the full picture. That's worth stopping on. The treatment you weren't told about has a longer track record. It has better quality of life outcomes for most patients, and it's a fraction of the disruption to your daily life. You can't choose something nobody showed you. If this is new information, subscribe so you don't miss the next one. I cover prostate cancer treatment in plain terms every week. Most of what I talk about doesn't get said in a 15-minute appointment. For low and intermediate risk prostate cancer, LDR brachytherapy gets equal or better cure rates than proton beam. The quality of life numbers are better, and most men are home the same day. Here's what it looks like. The procedure takes about 45 minutes under local or general anesthesia based on your preference. Radioactive seeds go directly inside the prostate. They deliver the radiation from the inside out. No daily drips to a clinic, no 6-week treatment course. Cure rates for low and intermediate cancer run above 98%, in experienced hands. That's not new data. That's 20 years of patient outcomes. Proton beam runs at a similar range for the same group, but the side effects are different, and the disruption to your daily life is completely different. Men who work, travel, or run a business are often the right candidates for brachytherapy. Men who just retired and don't want their first year filled with medical appointments, those men are getting steered toward proton beam instead. Tom was 62. He owned a pool company. He was told he needed surgery and would need 3 months off work. That would have put him out of business. He came to me. We talked through every option, and he had brachytherapy. He was back running his company within days. His cancer is gone. The 45-minute procedure that sends men home the same day with a cure rate above 98% has been available the whole time. Most men just never got to hear about it. Here's one move to make before your next appointment. Most men who come to me after being told proton beam is their best option weren't misled on purpose. Their doctor believes in what they offer. Brachytherapy left most US clinics about 15 years ago when more lucrative treatments became available, like IMRT. Fewer doctors can do brachytherapy now, so it stopped coming up. When you walk in knowing the numbers, you can ask one specific question. A provider who knows the evidence will engage with it. One running on autopilot will get defensive. You can raise this without sounding confrontational. Start by saying you've been doing research and want to look at all the options before you decide. What to say? I've been reading about brachytherapy for my risk level. I want to understand how it compares to proton beam for my case. The question, based on my Gleason score and stage, how do the outcomes compare between brachytherapy and proton beam? Can you refer me to a brachytherapy specialist? What a good response sounds like. Your doctor walks you through the cure rates and side effect comparisons or refers you to a brachytherapy specialist. If the provider defends the myth, ask for the specific study that shows the proton beam gets better results than brachytherapy for your risk group. If they can't name one, get a second opinion from a brachytherapy specialist. Proton beam is a real technology. For some cancers, it's the right call. For low and intermediate risk prostate cancer, the data doesn't support paying more for it. A 45-minute procedure with a 98% cure rate exists. The best option for your prostate cancer isn't always the biggest machine in the room. There's already a video on this channel that goes deeper on why brachytherapy disappeared from most clinics and what the full outcome numbers look like. It's called After 15,000 Patients, I Changed What I Recommend for Prostate Cancer. Watch that one next.